Hi, friends. Welcome to the Pain Free Birth Podcast. I'm your host, Karen Welton, a certified doula, childbirth educator, and mother of three. In this space, we'll hear positive, supernatural, and yes, even pain-free birth stories from women just like you. We'll explore the deeply spiritual side of childbirth and how God designed women's bodies brilliantly for birth. Let's get started. Hi, Natalie. Thank you so much for coming on.
Of course.
You guys, I am so excited about working with Natalie. I have, it's been on my heart to help women trying to conceive for a long time. And really, I just love talking about the holistic aspects of pregnancy, birth, fertility, motherhood, our womanhood, our femininity. And so getting to work with Natalie is such an honor. She is so brilliant. Natalie, for those of you who may not know her, and I feel like I'm introducing my audience to you for the first time, but Natalie is the PCOS doc on Instagram. She is a functional medicine doctor that specializes in hormones, PCOS, and infertility from a holistic approach. So, Natalie, why don't you just share a little bit about what you do and what you're passionate about here?
Yeah. So I really have a strong passion for women's health, especially since my own experience with the conventional medical model and things like that. It kind of led me down this road of practicing from a more holistic approach and really focusing on a comprehensive approach to women's health and really looking at the whole picture, the whole body, what's going on in the entire, world and life of a woman, because all of that goes into her health. And a few years ago, I kind of realized my passion really was in the fertility side of things because I kept noticing all these issues in the fertility model. And then I kept being able to help my patients get pregnant naturally. And I was like, oh my gosh, there's like a whole need for this and women need this so bad. So I really kind of subspecialized in that. And I'm so glad I did because it's literally the best thing about what I do, I think, honestly.
It's got to be very fulfilling to help
fulfilling.
Women and families get pregnant.
Yes.
So we're just going to cover, I want to introduce my audience to this is for really anyone who is not just preparing to get pregnant or trying to conceive, but even if you already are pregnant, we're going to talk about some things you need to know in order to get your body ready for pregnancy, which is also going to help you carry that pregnancy to term and have a healthy birth and postpartum. So a lot of these concepts, a lot of these tech tips that Natalie's going to share with us are going to be relevant for almost anyone here if you're planning to have a baby soon in the next year or so, trying to conceive or even pregnant. So Natalie, what are some of the simplest, most practical things someone can do to prepare their body for pregnancy?
Yeah. So there's a couple different ways to look at this. So from my clinical brain, my first thought always goes to labs. And making sure that you know what's going on internally from an internal approach and a holistic hormone approach as well. And really understanding what your numbers are looking like to set yourself up for success with pregnancy. So that's where my brain goes just initially is what do the labs look like? What are the hormones like? Where are they at metabolically? And then the second thing is really taking an environmental approach to reducing environmental exposures as much as possible from the environment to give the body an easier transition into that preconception phase. Because if we're overburdened with toxins and chemicals in our environment and our toxic bucket is full, when we go to conceive, we are then sharing those toxins with our future baby and sharing the same bloodstream with that baby through the umbilical cord and kind of those nutrients that we carry in our body too. So if we're nutrient depleted, that can pose an issue during pregnancy and for our babies as well. So I kind of like to look at it from an all-around approach and figure out what's going on in the body, what's going on in their environment. And then also, is their body ready at this time? Is this the right time for them? So that's really what I want you to think about is really reflect and feel like, is my body physically ready right now? Have I taken the time to really prepare my body? And I really suggest giving your body time to do that instead of just, rushing into it because of a timeline or a wedding date or whatever it may be. I know a lot of times people try to plan their pregnancies around a timeline. And I'm make sure you're listening to your body's timeline because your body will tell you when you're ready. And that's, I think, really important to be aware of.
I love that. I think there's so much to be said for like the intuition and following our feminine intuition and also tapping into our body's wisdom, because our body knows when it's fertile, when it's even like when you're ovulating, some women can feel it or tell. And like
Totally.
nutritionally, there's a lot we can do to bring ourselves to a point where we are at our peak functioning, capabilities and our most fertile, and making sure we have healthy stores of nutrients and fats and all of those things. What are some of the like most common blockages that women struggle with to get pregnant that you come across in your
Yeah.
practice?
Yeah. Some of the main things I see is low mineral status. So not having enough of essential minerals like magnesium and iron and nutrients in their body, like fatty acids. I think you might have even mentioned that. Fatty acids are so important to check going into pregnancy, but then also not having enough of the precursor hormones that we need to make our sex hormones that are essential for conception and essential for the entire process from ovulation to conception to maintaining a pregnancy. So we need hormones from pregnenolone to DHEA to progesterone, estrogen. They all play like beautifully in this symphony. I always say the hormones are like a symphony. And if we have one instrument that's out of tune, then the whole symphony will be off. So we really need to make sure that we're ready from that approach as well, and that perspective as well. And I've noticed a lot of women will come in and their hormones are imbalanced in certain ways, or they don't have enough of the hormones that they need to sustain a pregnancy or even initiate a pregnancy. So that's probably the biggest thing that I have seen.
Fascinating. And so that would be something where they take a lab to see like what levels their hormones and minerals are at.
Yeah, absolutely.
And I love that approach, because it's not just like, let's just slap like a one size fits all approach on infertility, or like getting your body ready, because each of us are different. Our bodies are different. And instead of just taking like a multivitamin or prenatal and saying, oh, well, that'll do it, really knowing what your body needs and working with your body to support it in pregnancy is so important. And I think that also plays a huge role in how we recover postpartum and how we feel, how that transition happens into motherhood. So setting yourself up prenatally, is so important and can really have ripple effects throughout your pregnancy and your postpartum when we make sure we're healthy in all of these ways.
Oh yeah, 100%. That's a really fantastic point too. Everything that we're doing in the preconception phase is also going to transition over to that postpartum phase as well, and make it a much more gentle transition and process. Like if we are depleted of things like vitamin D and iron and ferritin and our essential hormones and sex hormones, then when we go into the postpartum phase, it can be a very rough transition. And I have seen that happen too for women who just weren't quite prepared. So that is a really good point that I think you made too.
Yeah. If someone like doesn't have access to all the labs, or they're just like getting started and they're thinking about like, I want to get pregnant, what are some vitamins, minerals, or foods they could be eating just as like first steps to kind of get started, to start thinking about this nutrition and health in a positive way toward pregnancy?
Yeah, I love that question because nutrition is such a big piece of this. I love, and I do suggest lots of quality fatty fish, so wild caught fish, grass-fed beef, grass-fed meats, quality eggs, so pasture-raised eggs whenever possible, obviously, right? Choline in our egg yolks is so important for pregnancy. It's like, I think, one of the most important nutrients in pregnancy across the board. But just honestly, quality food that comes from the earth. I always say if you can get it from the ground and where it makes a sound, if it's living or comes from the ground, it's probably a safe place to start. If it comes from a box or a package, it's probably not ideal for preparing your body for pregnancy. So honestly, when you kind of get back to that kind of grassroots approach, it just makes things more simple anyways, simplifies. You're looking at whole food sources, quality meats. Honestly, if you can do organ meats, that's also fantastic. Nature's multivitamin, things like that. And fatty fish are like amazing. And then obviously antioxidant rich foods. So dark berries, and any sort of foods that are rich in antioxidants are amazing as well. So that's honestly a really good starting point if you're doing all of that right now.
That's awesome. I love that. Just practical tips. I remember for my pregnancies, I was eating like about 3 eggs every morning to get that choline in, because it's one of the few foods that provides choline. And then, just doing lots of greens and nutrient rich food. So that's always so helpful. what kind of, if someone has been struggling to get pregnant and hasn't had good success with it, or they've had multiple miscarriages, maybe they've even been to the doctor and like tried to find help, and the only avenue very often presented is like IVF or IUI, and using some of these very expensive, very invasive procedures in order to try to help their body get pregnant, or being put on medications to help, increase ovulation. What's something that you would do, or how do you work with your clients and patients in really looking at this from a holistic perspective, and how does that differ from the medical model?
Yeah, I love that question, because what I see happening in the traditional fertility model is the approach is your body's broken. I'm going to give you a pill to fix it. And that is not the right approach, because we're not broken. Our bodies are not broken. There is a reason why we're not responding a certain way, or reason why we may not be ovulating consistently, or whatever it may be. And I always tell my clients, your body's trying to do something for you, not to you. So if you're having trouble getting pregnant, there's almost always an underlying cause. And it's almost always a very simple fix that's just never looked into, because it's like, oh, well, we have this drug to give you. We can give you that. Why would they waste the time looking deeper and finding the root cause when in their mind, it's a quick, simple fix? We can induce it with a medication. We can do this. We can synthetically alter this. But the problem there is that women deal with the after effects of the medications and drugs and things like that they have to take in the process, and then they're not guaranteed an outcome. So like the difference between what I'm doing and what's happening in the conventional fertility model is that I'm really taking a root cause approach and figuring out why the body is not doing this in the first place, whether it be holding a pregnancy or even getting pregnant in the first place. And I figure out why that's not happening. It's like, if you have an electronic that's broken, do you just, throw it away and get a new one? Or do you look and see, like, is there a missing part? Is there something that it needs? Is it not plugged in right? You have to kind of take that internal root cause approach. Otherwise, what we're doing is we're strong arming the body and forcing it to do something it's not quite ready to do. And then that is where we put ourselves in situations where we respond really poorly to these meds or these IVF drugs that are required, or our bodies really reject these pregnancies because it's not a natural route for the body. Now, there are very few cases and very select cases where it's totally necessary because of a structural issue or a genetic issue. But in most cases that I've seen with my couples that have gone through IVF and then come to me after, they didn't actually ever need it in the first place. And a lot of them tell me, I wish we would have found you first, or I wish we would have tried this first, because we were just always told that IVF was our only option and it was our only answer. And they didn't know any better. They thought they were going to the best of the best, and they thought that they were spending their money where they had to spend it. But the sad part is the simple things were never actually investigated. There was never investigation into why their body wasn't responding in the first place. And then the biggest issue that I see after that is that it kind of becomes this definition of insanity, because what they see, one round doesn't work, let's just try it again. Let's try it again. Let's try it again. And it's like, if your car is not starting, it might be because you need an oil change, or it might be because of whatever. You probably just shouldn't start consistently restarting the car over and over and over again. And that's kind of like the thought process of IVF. It's like, oh, well, that round didn't take. Let's do it one more time. Let's do it one more time. And the problem is the emotional, the emotional process that women have to go through that, and the emotional impact that they go through is so heavy that oftentimes, but by the time they get to the point where they're ready to try something else, they're so emotionally fatigued and exhausted that they have nothing left in their tank to put in the effort and to put in the time to take that holistic approach, because they're just gassed. They're so tired of trying all these different things, and then the heartbreak every single month of being let down. So it's a whole process.
Yeah. And it can be very traumatizing. It's a very almost unnatural way to force your body to like overproduce eggs and conceive. And there's also risks to it. There's higher rates of NICU admissions or preterm births and complications that happen. So I love the root cause approach. I love the hey, try it naturally, try a natural approach first. And if that doesn't work, then explore other options. But, why is your body not conceiving? Why is your body not fertile? Why is your body not holding or carrying those pregnancies to term? Like, what's going on under the surface? And I love that you take this functional, holistic approach to that, and that some of the solutions can be so simple, whether it's like a mineral deficiency or a hormone imbalance or, something going on. And so what I'm so excited to why I'm so excited to be working with you is that we wanted to release or open up the doors to the pre-pregnancy fertility program that we're both that Natalie kind of spearheaded. She called me up and said, "Hey, I want to partner with you on this." And I was like, I love this concept. I love this teaching. And so Natalie's going to be, what we're doing is we're meeting live on Tuesday nights, and we are filming this. So the first run through is going to be the live portion where you get to ask questions with Natalie and myself, and we have other guest speakers on there. We're also, her husband's talking about a men's fertility boot camp, because how many of you guys know it's not just the women, it's sometimes the men and low sperm count that can impact infertility. And so if you're someone who desires to be pregnant or has struggled to get pregnant, or even just wants to be in the best possible health of your life and be super healthy to prepare for pregnancy and motherhood, this is something I'm so excited to talk about and to bring, to just make people aware of the expertise that Natalie brings in really like zeroing in. You have such a gift to like really investigate the like unique blockages and issues that are really holding up or blocking pregnancy and or depleting women in their bodies. And so tell us a little bit about what your goal is for this program. And then I'll share a little bit about the sessions I'm doing, which are really talking about the roots, the spiritual roots and emotional roots of infertility that we almost never hear talked about.
Yeah. So what I'm going to kind of be hoping to teach in this program, and what I wanted to do was create a community for women who are trying to prep their bodies for pregnancy, or who may even be walking through infertility at the moment, provide them a community. But then what I explain it as is I want to give women a bird's eye view into my practice, into what I'm doing, and create it and teach it in a larger group setting. Because I'm so limited to the amount of clients I can see one-on-one, that there's just no way for me to be able to physically help as many people as I want to. So what I like to do is teach in a group capacity and allow a larger amount of people into my office, into my brain, and walk you through the actual steps that I take with every single one of my clients and cases, especially in the pre-conception phase and even right into the pregnancy phase as well, once they get that positive test. So in the first module of our course, I'm going to be talking about literally all the preconception labs I run, and then the exact values I want to see those labs at. So I actually even created a spreadsheet of like my ideal lab values, every single lab I order on all my clients, and where I want them to be. And you can even plug in your own labs to see where you need to be in relation to the optimal ranges that I have created for you guys. And then what's really amazing is we're going to go into all the other facets of the preconception journey. And that's preparing your body through quality nutrition and what nutrients you really need to be focusing on. We're even going to be we're doing a section on how to support your body through pregnancy with essential oils and essential oils for pregnancy and birth and all the different in postpartum, which is a huge, huge important phase. And then on top of that, talking about pelvic floor health and how important preparing your body physically is for that next stage of life. So many cool modules within that. And then obviously the male fertility factor is massive. So infertility is 40% due to male factor, 40% due to female, and 20% unknown. So
is that high for the male fertility factor?
Yeah, it's 50-50, like male to female, 50-50.
Wow. Okay, that's huge.
Yes. So I suggest, all the men, we suggest they go through this program with you and do every single thing that you're doing, because if they're not focusing on all these preconception habits, it's going to delay your journey. And we tell every single one of our clients that have your husband or have your partner go through this with you, implement all the same things you are. And that is where we see the highest success rates. Because if men are stressed, they're overly sedentary, they're exposing themselves to inflammatory foods, then the quality of their sperm is not going to be there. But the coolest thing is men can actually drastically change the quality of their sperm in about 90 days. So they are much luckier than us. It takes us quite a bit longer, and we can't always change the quality of our egg health that fast, but men can with their sperm health. So it's really, really interesting that they can actually hop right in implement changes and then see such rapid results. So that's a big part of what we want to talk about too is, hey, let's not forget the male partner. They matter a lot. That sperm health really, really matters. So that's why we're going to kind of bring in my husband, Dr. Jake, and have him talk about that, like male fertility from a holistic perspective. So that's going to be really fun.
That's so exciting. We got a question from a listener that I want to touch on that kind of relates to this, and we'll do some more questions at the end if we have time. But how long after taking, I think it was contraception or like the birth control pill, would you recommend trying to get pregnant?
Okay. In a perfect world, I suggest 9 months to a year. Wow. At the very soonest, 90 days. Like in my mind, the very soonest 90 days, because your body really needs time to separate itself and then also remove those synthetic hormones from circulation. So it could take up to 9 months to do that. So I suggest at the earliest thought that you might want to start a family, getting off the pill is like one of the very, very first things that needs to be done, because those are synthetic hormones in your system that can cause disruption, not only in the hormones in your body, but then also in the gut. So that's a big part of what we talk about too. We have a whole module on gut health within the course and how gut health actually impacts fertility directly and how gut health can cause infertility and what the kind of underlying factors are to that, the different autoimmune markers for that, and how many women actually fall into that autoimmune category that need to be aware of kind of what that looks like.
Yeah, this is like so exciting to me because like this is really getting into the weeds here. Like it's not just like a, hey, take this one test, take this one pill. And if you're used to like, I'm just going to go to the doctor and take a, get a birth control pill because my hormones are whacked out, my periods are painful, or I'm going to go to the doctor because now I'm struggling and I'm hormonal and I want to get pregnant. So now I have to take pills to like ovulate. If you just want a quick fix solution, this is not the approach. Like this,
I was just going to say that.
So like, if you're wondering, is this really for me? And you just want that quick fix, that this isn't for you. But if you are someone that is really serious about taking control of your own health and fertility, and you want to be empowered to actually create a healthy lifestyle, not just to get pregnant, but to have a healthy pregnancy, a healthy postpartum, be staying healthy into motherhood for your kids and your family. This is like a whole different way of thinking. And it really empowers you as a woman to take control of your health, to really get clear and understand what those health markers are that you need to look for in order to take back power over your fertility and your health, to get healthy hormonally, to understand what biomarkers to look at, what nutrients are important, where you might be depleted. So this doesn't just impact your pregnancy or your conception of baby, but throughout your lifetime. It's just a different way to think and a different approach. And it's when I fully believe in that. If there are issues with getting pregnant, if you've struggled to get pregnant, your body is speaking to you. Your body is telling you something. It's saying, hey, I'm not okay. There's something going on in here that we need to address. If you have heavy periods, if you have really hormonal mood swings, really painful periods, that's another sign your body's struggling. It's trying to detox. It's trying to process things out. If there's lots of hormones and emotions, and like, obviously like some emotions and cramping are normal, but you shouldn't be doubled over in pain. You shouldn't be like incapacitated for a day. So, or if your body hasn't been able to get pregnant, or you don't have a regular cycle, like all of these factors are just little warning signs of your body, like going, hey, pay attention.
Please help.
Please help. Please support me. And so what we're doing in this program is we're giving you the tools to like practically support your body in the exact precise way it needs, and really pinpoint the areas where it needs the most support. And what I'm teaching two modules. It's an 8-module course. I'm teaching 2 modules on confronting our fears toward pregnancy, because a lot of women actually have spiritual and emotional blockages toward getting pregnant, whether that's fears we grew up with. And I talk about this a lot on my Instagram and in my courses, but sometimes it can even be so powerful that it prevents our body from opening to receive the sperm and receive, the conception. And we can actually block our own pregnancies by the fears and the inhibitions we may have toward getting pregnant, toward motherhood, all of those things, as well as looking at some of the spiritual roots of infertility. And so this is really going to be like a multifaceted approach. We're looking at nutrition, we're looking at labs, we're looking at hormone levels, we're looking at gut health. We're also looking at what spiritual roots are going on and playing into some of the symptoms I may be having, whether that's having experienced multiple miscarriages or an irregular cycle, or if you struggle with conditions like PCOS, endometriosis, cysts, ovarian cysts, any kind of disorder or diseases like happening in the feminine organs, there's a lot of spiritual roots that connect to our own perception of our femininity, our motherhood, how we relate to or connect to our own mother. There's mother wound issues that we need to sort through because we've taken on throughout our lives as women, if we have trauma that we have rejected our own femininity or womanhood in any way, that we've received like negativity, or someone has spoken negatively over us, whether that be a leader in our life or a mother or a father, if there's a sister wound, and there's been any kind of like, even subconsciously, usually these things are subconscious until women hear about it and they go, oh my goodness, I so relate to that. And so a lot of these things can cause us to reject our own womanhood. If we've been told, like, being a woman is, you're the weaker, vessel, or you're cursed, or childbirth is so painful, and we take on these negative connotations toward our femininity and our womanhood, it can actually like make our hormones go off. It can suppress our feminine organs. It can suppress ovulation. It can cause your eggs to be immature or not fully developed. I've worked with women having all these scenarios that when we healed the emotional root, their body shifted and healed, and they were able to get pregnant within the next month or two. Sometimes it happened really quick. Sometimes it was a few months. But when we unlock that spiritual root in connection with also focusing on the nutrition and like the practical things that we're talking about here, it's like a double whammy. So you can really get to the root of what's really going on in your body, not just your body physically, but your hormones, your heart, your spirit, and how all of those things connect. Because if you guys have been following me for any length of time, you know that I'm not just interested in like giving you more head knowledge. Like my course is not just a ton of head knowledge I'm going to dump on you. It's actually preparing your heart for birth. And what we're doing here is preparing your heart and your body for pregnancy so that you're fertile in your gut, in your ovaries, in your body, in your heart, in your emotions, and you're ready to receive that baby and start the family or continue the family that you want to have. And so this is such a unique course because we're really approaching it from those multiple angles. And I don't think there's anything else out there that really discusses it at that level. So I'm so excited. Let me get to, there was a couple questions. Did you have anything you wanted to say about any of that either?
Yeah.
Or like about the course? Yeah.
Yeah. The only thing I wanted to add, and just to piggyback on what you said, is like the whole purpose of this model, this approach we're taking is we are trying to put the power back in the hands of women and of patients, because women are totally powerless in the conventional fertility system right now. They're told when they have to have sex. They're told when they have to take meds. They're told when they can do whatever. And the power is completely stripped from you. And that's the worst thing that I hate seeing for women, because what we want you to do is we want you to be able to heal your own body. We want you to be able to look at your own labs and understand what they mean, understand what your body needs, understand when your body is ready. And then you make the call. You make the final decision and you take the power back, because we don't want you stuck in this powerless system where someone in a white coat is telling you what you have to do, when you have to conceive, when your body is ready. That is not what we want for women. So I really just want you to take that away too, is to understand that it's time for you to be in control and for you to be in the driver's seat. And we just want to be your navigators and walk with you through it. And that's what I try to do with all my clients and all my courses and everything that I do, because I don't want to ever feel like a dictator where I'm telling someone, you can't do this, you can't do that, you have to come in on this day. Like, it should be on your terms. And that's so important to me. 100%.
We're all about, and that's why I think I love working with you. It's because we so value that we want to empower your intuition. Like, this is your body, this is your femininity, this is your fertility. And we want to empower you in your intuition and in your consciousness. Like, even we're talking about conscious conception and what that looks like, to remove it from this like medical model of thinking and really infuse it with love and intuition and care. And how does the body operate best when it's given what it needs? Not just the nutrients, but the love, the care. And we actually start listening and connecting to our bodies again, because many of us are disconnected. Many of us are numbed, whether it's from birth control or just drugs and medications, it's really easy, or stress, it's really easy to disconnect and ignore all those signs our body is giving us. But our goal here is to empower your intuition and help you reconnect intuitively to what your body is actually saying, interpret and decipher those signs and symptoms and labs, and really get to the root of what's going on so you can thrive in pregnancy and in motherhood. And so what's something I saw a question earlier about, like, can you talk about nausea, and do you have any recommendations for all my pregnancy?
Yes.
This is going to be worth it. So stick on. Like, what can we do about nausea in pregnancy?
Yes. So funny that was asked, because we have an entire module on how to prevent nausea in pregnancy and how to manage nausea in pregnancy. So there's a huge mineral component to nausea, a huge nutrition and mineral component. If you are currently pregnant and you're struggling with this, some of your best friends are going to be vitamin B6 before bed and magnesium, magnesium glycinate, ideally. Citrate is more for the bowels. So it's not really it's more to move the bowels. So that's not really going to help you. I just had a friend reach out to me yesterday dealing with terrible nausea. And I was like, are you taking B6 and magnesium? And she was taking the wrong types. She was taking B12 and she was taking the wrong type of magnesium. So I was like, let's get you on something a little bit better. And then also,
so B6, and what type of magnesium should they take?
Magnesium bisglycinate, ideally. Yes.
All right, write that down, ladies.
Yes, ideally. And then the reason why I love essential oils so much, quality essential oils, is because you can use those really strategically as well. You can put a couple drops of cinnamon and a couple drops of ginger in a little capsule, and that will soothe your stomach, or a little drop of peppermint under your tongue. Like, there's so many things that you can do along those lines that will really help. You can even put oils on topically that will help with nausea. We have a lot of clients that deal with nausea for other reasons, for whether it be gut infections and things like that. So we've kind of gotten pretty good at these nausea protocols to help people work through this. And then same with pregnancy. It's one of the top questions I get from my patients. As soon as they get pregnant, they're like, what do I do now? So
so that we're going to walk you through that too. Once you get pregnant, like, how can you best support yourself? Can you talk for like a minute on cholestasis? Is that something that you can help women with?
That's actually not something that I have planned, at least, to talk about in the program. That's going to be more something that is going to be a case by case basis. And that we'll need to work with someone through. But I think it's totally manageable and totally preventable.
I think it's making sure like those nutrient levels and certain hormone levels are in balance. I think it can be, again, with this approach, you're taking preventative measures too. And so if cholestasis is something that you've struggled with in the past, I saw a question on that, then making sure you have adequate mineral stores and nutrient stores going into pregnancy and supporting it during pregnancy is really just going to help you thrive in all ways. And preeclampsia is a big one. We're talking about that as well. Avoiding preeclampsia, because most doctors won't even tell you how to avoid it, or that they know what causes it, but we do know what causes it. It's toxemia, and it's a deficiency in key nutrients and minerals, and eating a high protein diet of quality meats can very often prevent preeclampsia, and making sure you're flushing things out. I mean, do you have any specific recommendations on preeclampsia?
You touched on minerals. That's extremely important. High protein for sure. And then making sure you're getting quality salts, and managing blood sugar also goes into that as well, because blood sugar can contribute to stress and high blood pressure and all the different factors there. So a lot of what goes awry in pregnancy is rooted in blood sugar dysregulation or dysglycemia. That is very, very common. So blood sugar is going to be something throughout the entire program, probably in every module that's going to come up. In all of my programs, that's always what happens, is I end up talking so much about blood sugar. Because truly, if we're not eating quality protein, we're not getting enough protein, or our bodies are not nourished properly, blood sugar levels are going to be the first thing that goes awry. And then what happens is that throws off our stress hormones like cortisol, and then that causes issues as well. So if we can get blood sugar under control, that is massively impactful for a lot of women, for a lot of the issues that were just mentioned in general.
Yeah, absolutely. And if you're someone who may have struggled with gestational diabetes, or you have diabetes in your family and there's a history of that, this is going to be really important information for you, because some of these things like preeclampsia, gestational diabetes are curveballs that, if we're not really taking care of our bodies in pregnancy, leading up to pregnancy and throughout pregnancy, they can creep up really fast and have a big impact on your health, how you carry out your pregnancy, and even especially your birth. It can be a big reason that doctors and providers recommend induction, and this beautiful, natural or pain-free birth you've been planning suddenly gets sabotaged because of an unintended, medical risk factor that pops up at the end of your pregnancy. So we want to work on also preventing all that, because it takes a lot of mental work to prepare for labor, to get pregnant, to prepare for pregnancy and birth. And we want to set you up to succeed and thrive in every area. And so I absolutely love that. And what we're doing is having these calls. And you guys, this is something that if you want to get set up for a healthy pregnancy and birth, and if you want to, especially if you've struggled with infertility or multiple miscarriages in the past, this is something that we're really giving you like the easy button where we're empowering you to take control of your health and fertility. And whereas it might cost thousands of dollars to either work with Natalie one-on-one or tens of thousands of dollars to do IVF or IUI, these treatments get so expensive. It's a for-profit industry. And if you want to take a different approach and avoid that and save potentially thousands of dollars, we invite you to join us in this course. We're doing it every Tuesday night. There are replays available. We're doing Q&As after each one. So make sure you're in on this first call, because in the future, it will not be live every time. So you get the opportunity to ask direct questions to me and Natalie. And I'll be teaching 2 sessions, as I said, on the spiritual roots of infertility, which is something that you may have never addressed. And maybe you've already done fertility treatments and you keep trying to kind of do the same thing over and over again. What if we tried something totally new? What if it's actually a spiritual root? What if it's actually an emotional root or a mental block? We're going to talk about all of that. And so join us. We had our first call last night. You'll get the free recording of that sent to you. Sorry, on Tuesday night. It's Thursday now. But you'll get that free recording where it was all about labs and what labs you might want to take and where your markers are. Next Tuesday, this coming up Tuesday, is on nutrition. And so the information is all on the website, on PCOS Doc's website. I have a link at the top of my bio so you can sign up and join us there. If you have any questions, just comment on the bottom of this live. I'll save it and post it to my profile so you guys can ask us more. And we are so excited to support you on your journey, and really just cheer you on.
Yeah, we're so excited. We hope we see all of you in the program too. We would love to have you.
Thanks, guys. Take care. Bye.
Bye.
Thank you for listening to this episode of the Pain-Free Birth Podcast. If you were encouraged, it would mean so much if you left us a 5-star review and shared this with your community. I'd love to connect with you on Instagram at painfreebirth. And to learn more about the Pain-Free Birth e-course, free resources, private coaching, and upcoming events, find out more at painfreebirth.com. See you next week.